here in Honolulu, Hawaii, at the annual meeting of the American Psychiatric Association. There's a presentation on the specific challenges doctors can face when they have patients who have both depression and diabetes.
So a take-home message for this is it's very important for primary care physicians to be thinking about screening for depression among people with diabetes, and there are good screening scales nowadays like the PHQ-9 that you can use to screen. And then it's very important to either provide the effective treatment or refer to a mental health professional who will provide that effective treatment, because depression is as big a risk factor for adverse outcomes as poor glucose control or other aspects of diabetes like high cholesterol levels that we know lead to bad outcomes. So when we think about diabetics, we think about let's control their cholesterol, let's get their blood pressure below guidelines, let's get their hemoglobin A1C below 7. A fourth category here is let's treat their depression effectively, because it has an adverse effect in these folks, both in their quality of life but also in the adverse outcomes. Depressives are more likely to develop diabetes earlier in life than other people. And then once they get their diabetes, the evidence is very strong that people with depression don't adhere as well to their disease regimens. So they're less likely to check their blood glucoses regularly. They're less likely to follow a diet, to follow exercise regimens that have been scheduled by their doctor, and they're more likely to not adhere to medication regimens. And the result is that, from our research, that people with depression and type 2 diabetes run over a 5-year period about a 35% increased risk of macrovascular complications like stroke and heart attack, but also run about a 35% increased risk of microvascular complications like retinopathy and nephropathy. And then, of course, once you develop a complication like losing your vision or losing a foot due to an amputation, you're more likely to get depressed, or the depression is less likely to go away if you already have it. So, again, that speaks to the sort of bidirectionality of these two illnesses.
This has been Damian McNamara reporting from the APA meeting in Honolulu.